Hello, scholars. My name is Dr. Kerris Dillon, and the goal of this channel is to make academic subjects easier to understand. If you haven't already done so, please click the subscribe button and don't forget to like this video. That way I can keep producing the videos that you like best. In the last video, we covered depersonalization and derealization disorder. In this video, we're going to cover somatic symptom disorder. So let's begin. Before we get too far into the video, I want to tell you a quick story about this disorder. So from a young age till I was 32 years old, I saw close to about 40 to 50 doctors wanting to find a diagnosis for my nausea, my throwing up, my dizziness, weight loss, and fatigue. I ended up all over from La Crosse to Iowa City to the Mayo Clinic in Minnesota. And multiple times I was told that my throwing up, my nausea was psychological and that I needed psychiatric care because I was making up my symptoms, or as they claimed, I was forcing myself to throw up. After a random kind of thyroid test in La Crosse, which came out abnormal, an endocrinologist became really frustrated with me after I told him, I can't take that thyroid medication, it's making me sick. The guy just kind of turned and he said, fine, what do you want? We'll do an absorption test. Will that make you happy? I'm like, okay, I don't really know what an absorption test is, but sure. And I didn't think I was going to have anything different come back from the doctor. But within 2 or 3 days, I got a phone call stating that my absorption test was a little abnormal and that they wanted me to do a biopsy for celiac disease. And I didn't really know at the time what that was, but so they ended up doing a biopsy on me. And I remember, even though I was under some medication at the time, I remember the doctor saying, yikes, this is one of the worst cases I've ever seen. But why I tell that story is because sometimes when doctors can't get the right diagnosis, they automatically go to the field of psychology, or there's something psychiatrically wrong with an individual. And I got very upset, and still kind of am upset with the medical field about that. It'd be one thing if I saw 2, 3 doctors, and didn't get a right diagnosis, but literally for probably since I was 15, I was going to doctor after doctor after doctor trying to figure out what was wrong. And I remember multiple people bringing up this somatic symptom disorder when they can't find a medical explanation. Now, there are thousands of people out there that do have somatic symptom disorder, and we do need to take their symptoms very, very seriously because those are real symptoms to those individuals. But also remember, don't forget to keep trying different medical tests because, something may come up along the way that'll help to explain it. So in order to be diagnosed with somatic symptom disorder, an individual will have the following symptoms. A, the person will experience one or more somatic symptoms that cause distress and create problems for one's daily life. B, the individual will have thoughts, feelings, or behaviors that constantly center on health concerns, including A, continuous thoughts about how serious the symptoms are, B, having continuous anxiety about one's health, and C, spending lots of time on the symptoms or one's health concerns. C, although the individual may not have symptoms every single day, the person will be symptomatic given 6 months at a time. Clinicians will also want to clarify if the individual has constant pain and complains about pain on a regular basis. They will also want to specify, too, if the symptoms are persistent, in which they may experience severe symptoms, which will affect the livelihood of the individual for more than 6 months at a time. Individuals that experience somatic symptom disorder tend to have different types of ailments that get in their way of day-to-day living. Generally, pain tends to be the most common symptom experienced by those with the disorder. Some individuals might have pain in one particular area of the body, whereas others with somatic symptom disorder will have it all over their body. It's important to understand that when a person is diagnosed with the disorder, that they are truly suffering. If they fit under the criteria of somatic symptom disorder, they truly are having symptoms of something. Those persons with somatic symptom disorder tend to worry quite often about their health, especially their symptoms. They tend to believe their symptoms are indicative of dangerous or harmful ill health. When a person suffers greatly from the disorder, they may find that their identity starts to center around these difficult symptoms that they're having. For those that have somatic symptom disorder, generally individually, they will experience both physical and mental distress. Even when there is a tremendous amount of medical care that's provided, this does not tend to alleviate the symptoms as well as the worry that the individual has. If an individual is put on medication, persons with the disorder will often experience side effects. They also tend to feel that the medical tests or medical care that they have been given has been inadequate. One of the defining features of somatic symptom disorder is that the person will pay lots of attention to their symptoms each and every day. When the individual has sensations that take place within the body that most people without the disorder may experience, people with the disorder chalk up those sensations to being part of the physical illness. Obsessive worry about the future and fear concerning doing physical activity as potentially hurting their body is also a concern. When going to the doctor, they generally stop listening if the doctor does not find something and attributes the symptoms to a non-life-threatening issue. These individuals tend to seek out medical help and not mental health to help them. When asked if they sought out mental help, they will often get offended because they don't believe their physical symptoms are being taken seriously. Somatic symptom disorder is often associated with depressive disorders. There's also an increased risk of suicide with these individuals. The prevalence of this disorder is thought to be about 5 to 7% of the population within the U.S. Females do suffer more from this disorder than do men, but I also want to point out that there are statistics that show that women's symptoms are often not believed as compared to men's symptoms. So this is something all clinicians need to take into consideration. Somatic symptom disorder is often underdiagnosed with older adults because fatigue and pain are usually associated with growing older. It's often seen as more acceptable for older people to complain about symptoms as compared to younger people. With younger children, the most common symptoms of this with somatic symptom disorder are stomach pain, fatigue, nausea, and headache. Young children will tend to have one severe symptom as compared to having many symptoms at once. All right, well, we have reached the end of the video. If you have any comments or questions, please leave them in the comment section below and I'll get to them as soon as I can. I hope you all have a wonderful day and I will talk with you soon.